So my name is Paula Hall and I'm a UKCP registered sexual and relationship psychotherapist. I've been with UKCP for about 15 years now, and over the last 10 years I've been specialising in sex and pornography addiction. Sex and pornography addiction is still quite a controversial topic within professional circles because we don't really know if addiction is an accurate label for it. But what we do know is that more and more people are presenting for help who are struggling with compulsive sexual behaviours of one kind or another. And of course, the big issue with sex and pornography addiction is the impact it has on the partner. And what many people don't understand is just how different it is from, for example, an affair, and also how different it is from finding out that your partner might be addicted to drugs or alcohol or some other kind of chemical addiction. As a couple psychotherapist, I've been working with people who've had affairs and the impact that has on their relationship for many years. And when you're working within that context, you're sort of talking to the couple about how their relationship was before the infidelity, and what you're trying to do is help them work out how they can affair-proof their relationship and look at how their relationship can be once they get through this. And I guess the key difference with somebody where there has been, they discover sexual compulsivity or sex addiction, whatever you want to call it, is that it nearly always predates the relationship. So there is no before. There's no before to go back to. So most partners discover that actually this behaviour has always been a part of their relationship, but they had no idea. And the other difference, of course, is that there may not be an after. So when you're working, and it depends of course on how problematic the addictive behaviour is, but if it's someone where their compulsive behaviour is really quite significant, then actually you may be in a relationship with somebody who is always going to struggle with this problem. Hopefully they can get to a position, of course, where they're not going to act out anymore. They're going to, perhaps not view pornography if that's what they need to give up. Certainly not visit sex workers. Most relationships wouldn't want that to be happening. But they may still be struggling with triggers. They may still be somebody who is living a life that is in recovery. So it's a bit, for example, like having to accommodate some kind of illness into the relationship. So, for example, if you discover that your partner is diabetic or is struggling with a mental health disorder, that may always be a part of your relationship now. It's going to be something that you as a couple are going to be facing together. And I guess that's the work of a couple psychotherapist within this field, is to help the couple to develop a shared understanding of what this addictive behaviour is, what it is that's going on underneath, what it was that caused the behaviour, and how they can develop strategies to ensure that it doesn't happen again. And rebuilding trust is a really key part of the work, and for partners who feel as though perhaps their relationship has been a lie for the last 20 years, for them to actually sort of think about, how can I really rebuild trust for this person? How can I believe that they're not acting out is very, very difficult. And of course you can't prove what you haven't done. If you're living with somebody with a chemical addiction, I'm not suggesting you would, but you might ask them to do a urine sample or blood test or something. But there's actually no way of proving that you haven't acted out in a sexual way. So helping couples kind of develop an accountability plan, helping them develop a lifestyle where this addiction is no longer part of it, is the work that you're trying to achieve. And of course for some couples the decision for them is actually to separate. And of course if the relationship was in difficulty beforehand, then this may well be the last straw. But for other couples who feel that there is enough within their relationship that they want to salvage, that they want to stay, then rebuilding trust and helping them to kind of find a way of accommodating and understanding the addiction within their relationship is the work that you're trying to do. Sex addiction, I often say sex addiction is an equal opportunity condition. It can affect men and women, young and old, gay and straight, people with a faith, people without a faith, absolutely anybody can be affected by this. And it really is about, addiction is all about trying to find a way of escaping painful feelings. It becomes a way of escape, and whether your way of escaping is into alcohol, into drugs, into gambling, into video gaming, into, for some people, into work, it's not about the actual behaviour itself, it's about what you're escaping that defines it as an addiction. So I suppose addiction at the end of the day is a coping strategy. It becomes a coping strategy, but it tends to create even more problems in your life that you have no strategies to cope with, and it becomes a primary coping mechanism. And really the definition of addiction is the dependency on that behaviour for self-regulation. Just to be able to feel normal, you become increasingly dependent on that behaviour, and that's when it becomes an addictive process. If you are someone who thinks you're struggling with sex or pornography addiction, or you're a partner who's just found out that that's happening in your relationship, there are really kind of three things that need to happen. One is that the person with the addictive behaviour needs to get some professional help and support on their own. They need to identify if this really has become a dependency, if this is a compulsive behaviour, and they need to have space to try and work out what's going on underneath. What is the cause of this? What are the feelings that they're trying to anaesthetise with this behaviour? What's going on underneath? And of course, very practical relapse prevention strategies as well to help them develop a lifestyle where they no longer need this compulsive behaviour. And the partner needs space for themselves as well. They need support for them. A place where they can work through their own feelings of shock, of anger, of grief and loss. The fact that their relationship is not what they thought it was. Their partner's not who they thought they were. So some space for them to really kind of grieve and work through those feelings and get their sense of self-identity back. Once they're in that place, that's then really when you begin to look at whether or not the couple relationship can survive. In the early stages, help with communication, help with, for those who've got children, simply being able to get up in the morning, get the kids to school, have a normal life, of course, needs to happen. But in terms of whether or not this relationship can survive, before you can really make that decision, you need to have gone through a place where the person with the addiction is able to get into recovery, have a real understanding of why this has happened to them and what they're going to do about it. The partner needs to have had time for the shock to have worn off and to get their sense of safety and stability back. Then as a couple you can look at the wreckage, if you like, and is there anything left that we want to actually salvage from this? Can we rebuild this relationship? Can we have a future together? I'm pleased to say many do, but it is hard work, and it takes some time. But certainly in our practice, we've had lots of couples move on from this and actually be closer than ever before, because once that huge dark secret is taken away, and often many couples had no idea what an impact this was having on their relationship until it came to light. And with the burden of that taken away, many couples are able to enjoy a level of intimacy and connection and hope for the future that they'd never experienced before.